everybody, welcome to episode 15 of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing the medication known as Labetalol, also known as the brand name Trandate. Now, this medication is classified as an antihypertensive, which means a medication that lowers blood pressure. It's also commonly referred to as a beta blocker. So, as an antihypertensive, you may have guessed, it is indicated in hypertensive patients, so people that have high blood pressure can use this medication to help lower that blood pressure. It's commonly paired up with other antihypertensive agents, such as thiazide diuretics, but it can be used in some situations on its own. This medication is available as a 100 milligram tablet, as well as a 200 milligram tablet. Before I discuss using the medication, I'm going to talk about some contraindications, or reasons you cannot use this medication, as well as some precautions to be taken before the medication is given. Individuals who have uncontrolled congestive heart failure cannot use Labetalol. It should also be avoided in people who have asthma, as well as people who have a history of obstructive lung diseases. If somebody has an atrioventricular block greater than the first degree, they should avoid this medication as well. Cardiogenic shock and states of hypoperfusion are contraindications. And finally, people who have sinus bradycardia. In terms of precautions, the first one that comes to mind is the risk of postural hypotension. This is something that happens to individuals when they're using medications like this, when they go from a seated to a standing position very quickly. This can cause a sudden drop in blood pressure, and sometimes it could even lead to fainting or syncope. To avoid this from occurring, patients should start on a small dose and increase that dose slowly over time. As well, they should avoid taking this medication with other alpha or beta blocking drugs. Beta blocking agents, such as Labetalol, may increase the risk of hypoglycemia, or low blood sugar, in patients who are prone to this condition. Also, diabetic patients using insulin or other oral hypoglycemic agents may be at an increased risk of experiencing hypoglycemia as well. Patients who are using a class 1 antiarrhythmic medication or a calcium channel blocker such as verapamil should use Labetalol cautiously because these medications may potentiate the cardiac depressant effects of Labetalol. Due to the reduced first-pass metabolism associated with patients who have chronic liver disease, lower doses of Labetalol should be used. This is because the oral bioavailability will be enhanced in these patients. Now, in terms of using this medication, the recommended starting dose is 100 milligrams taken twice daily. This is whether you use the medication by itself or if it's paired up with a thiazide diuretic or other antihypertensive agents. The usual maintenance dose seems to be about 200 milligrams to 400 milligrams taken twice a day. However, in some rare situations, some individuals may require a dose of up to 1200 milligrams daily. Again, this would be divided in 2 or 3 daily doses. The dosing frequency in these situations would be decided by your clinician. Sometimes lower doses are seen in older individuals. This could be due to gradual liver impairment, as well as an attempt to reduce the amount of falls experienced by the elderly. If you've been following along with Drug Talk, you may have noticed that I don't usually touch on pregnancy. This is simply because I believe that people who are pregnant should always direct their questions and get their information from their personal health care providers. The only thing I'd like to say about this medication in terms of pregnancy is that it is a medication that's commonly used to treat hypertension in individuals who are pregnant. Now, as like all medications, there are some side effects that you may experience while using Labetalol. I'll list some of them for you now. Dizziness happens in about 16% of individuals, and fatigue comes in at about 13%. 8% of people can experience a headache, and about 3% may experience some chest pain. Peripheral edema or swelling happens in about 2% of people. Nausea and vomiting happens about 6% of the time, and difficulty breathing comes in at about 4%. Interestingly, 2.6% of people can experience depression after using Labetalol. And lastly, visual blurring can happen in about 4% of people. The last thing I'll say about this medication before ending the episode is just to keep in mind that you're using this medication to treat high blood pressure. So, during the course of your therapy, if your blood pressure changes, you can expect changes to your medication, whether that be changing the dose or adding or taking away other medications. So don't be surprised if sometimes these changes do occur. Alright, that's it for today. We'll see you guys next time on Drug Talk. As always, remember to use my videos simply as a source of information and not to base any of your personal healthcare decisions around. If you think I'm providing valuable information and you'd like to see the channel grow, you can like the videos, share the videos, or subscribe to the YouTube channel. Alright, we'll see you next time. Take care.